Encephalitis. Introduction. Encephalitis is an inflammation of the brain, often caused by viral infections, autoimmune diseases, or bacterial infections. It can lead to serious neurological complications, including seizures, cognitive impairment, and even death. Understanding the causes, risk factors, symptoms, and treatment options is crucial for effective management and prevention. Definitions. According to the Centers for Disease Control and Prevention, CDC, encephalitis is an inflammation of the active tissues of the brain resulting from infection or an autoimmune response. According to the World Health Organization, WHO, a condition characterized by acute or chronic inflammation of the brain parenchyma, leading to neurological dysfunction and systemic complications. Risk factors. Infectious factors. Viral infections, herpes simplex virus, West Nile virus, enteroviruses, rabies virus. Bacterial infections, tuberculosis, Lyme disease, syphilis. Fungal and parasitic infections, toxoplasmosis, cryptococcus. Non-infectious factors. Autoimmune encephalitis, anti-NMDA receptor encephalitis. Post-infectious encephalitis, immune response following infections such as measles. Vaccination reactions, extremely rare. Environmental and lifestyle factors. Mosquito or tick exposure, vector-borne encephalitis. Poor immune system, HIV/AIDS, chemotherapy, immunosuppressive therapy. Age, infants, elderly individuals at higher risk. Geographic location, regions with endemic viral outbreaks. Etiology. Encephalitis can be classified based on its underlying causes. Primary encephalitis, direct infection of the brain by a virus, bacteria, fungus, or parasite. Secondary encephalitis, immune-mediated inflammation occurring post-infection or due to an autoimmune disorder. Types. Viral encephalitis, caused by viruses like herpes simplex, West Nile, or Japanese encephalitis virus. Bacterial encephalitis, caused by bacteria such as Mycobacterium tuberculosis. Autoimmune encephalitis, caused by the immune system attacking brain cells, often triggered by infection or unknown factors. Toxic encephalitis, caused by toxins such as heavy metals or drug overdose. Pathophysiology. Pathogen entry, virus/bacteria/fungus, through respiratory tract, bloodstream, or direct contact. Down arrow. Crossing the blood-brain barrier, BBB, due to inflammation or immune evasion. Down arrow. Activation of microglia and astrocytes, brain's immune response triggers inflammatory cytokines. Down arrow. Inflammatory mediators release, IL-1, IL-6, TNF-alpha, leading to neuronal damage. Down arrow. Brain edema and increased intracranial pressure, ICP, causing compression of brain structures. Down arrow. Disruption of synaptic transmission and neurotransmitter imbalance, glutamate excitotoxicity, decreased GABA signaling. Down arrow. Clinical symptoms manifestation, fever, headache, seizures, confusion, coma in severe cases. Down arrow. Potential long-term effects, neurodegeneration, cognitive impairment, epilepsy, motor deficits, or death in severe cases. Clinical manifestations. High fever. Headache and neck stiffness. Altered mental status, confusion, disorientation. Seizures. Muscle weakness or paralysis. Photophobia, sensitivity to light. Difficulty speaking or understanding speech. Behavioral changes, agitation, hallucinations. Loss of consciousness in severe cases. Diagnostic evaluation. History taking. Recent infections, travel history, mosquito/tick bites, immunization status. Symptoms onset and progression. Physical examination. Neurological assessment, reflexes, cognitive function, muscle coordination. Signs of meningeal irritation, Kernig's and Brudzinski's signs. Laboratory and imaging tests. Lumbar puncture, CSF analysis to detect viral, bacterial, or autoimmune causes. MRI/CT scan, to identify brain swelling, lesions, or hemorrhage. EEG, electroencephalogram to detect abnormal brain activity. Serological tests, to identify specific viral/bacterial antibodies. PCR, polymerase chain reaction to detect viral DNA/RNA in cerebrospinal fluid. Medical management. Pharmacological management. Antiviral therapy, acyclovir for herpes simplex virus, ribavirin for some viral encephalitis. Antibiotics, if bacterial infection is suspected. Corticosteroids, to reduce brain inflammation. Immunoglobulin therapy or plasma exchange, for autoimmune encephalitis. Antiepileptic drugs, to control seizures. Surgical management. Decompressive craniectomy in severe cases with increased intracranial pressure. Drainage of abscesses if present. Dietary management. High protein, nutrient-rich diet to support immune function. Omega-3 fatty acids, fish, nuts, for brain health. Hydration and electrolyte balance maintenance. Nursing management. Nursing assessment. Diagnosis. Interventions. Monitor vital signs and neurological status. Risk for altered consciousness. Regular neurological checks, seizure precautions. Assess fever and infection markers. Risk for hyperthermia. Antipyretic administration, cooling measures. Observe for signs of increased intracranial pressure. Risk for brain herniation. Elevate head, monitor for pupil changes. Assess speech and cognitive ability. Risk for impaired communication. Speech therapy, assistive devices. Prevention. Vaccination, MMR, Japanese encephalitis, rabies, and other relevant vaccines. Mosquito and tick control, use insect repellents, wear protective clothing. Good hygiene practices, hand washing, avoiding contaminated food/water. Proper immunization of immunocompromised individuals. Early treatment of infections to prevent secondary encephalitis. Complications. Seizures and epilepsy. Memory loss and cognitive impairment. Paralysis and motor dysfunction. Coma and death in severe cases. Psychiatric disorders, anxiety, depression, behavioral changes. Long-term speech and language difficulties. Hydrocephalus due to increased CSF pressure. Conclusion. Encephalitis is a serious neurological disorder that requires prompt diagnosis and management. Early intervention, supportive care, and preventive measures such as vaccination and vector control play crucial roles in reducing morbidity and mortality. Multidisciplinary care involving medical, nursing, and rehabilitative support is essential for improving patient outcomes.